Do you know the signs of diabetes that can appear at night? This is a question that might not cross your mind on a regular basis, but understanding the symptoms of this common yet serious health condition can make a world of difference. Today, we explore the subtle yet significant signs of diabetes that often manifest during the night. These nocturnal indications offer valuable insights into potential underlying health concerns. Feel free to write us in comments if you're facing any of the next symptoms. Firstly, an early symptom of diabetes frequently manifests as increased urination. If you find yourself waking up multiple times in the night to empty your bladder, your sleep pattern might get disturbed, and this could potentially be a sign of diabetes. This happens because when you have diabetes, excess sugar or glucose builds up in your bloodstream. Your kidneys have to work overtime to filter and absorb the excessive sugar. If the kidneys can't keep up, the extra glucose is excreted into your urine, dragging along fluids from your tissues, which increases your urination frequency. This physiological response is your body's attempt to flush out the surplus sugar and can be a red flag for diabetes. Secondly, night sweats is another crucial symptom to consider. If you find yourself frequently waking up in the middle of the night drenched in sweat, this could be an indicative sign of diabetes. Night sweats typically occur due to low blood sugar levels at night, known as nocturnal hypoglycemia. This happens when your body releases emergency hormones in response to low sugar levels, resulting in excessive sweating. Adjusting medication dosage and dietary habits can also aid in better management of night sweats in diabetics. However, these changes should only be made under professional guidance. Before we delve in the next symptom, don't forget to like and subscribe. Thirdly, symptoms of hypoglycemia, including not just sweating and trembling, but also a noticeable increase in hunger, confusion, blurred vision, and even heart palpitations, can occur at night. Hypoglycemia, or low blood sugar, is a condition most commonly associated with diabetes. The reason these symptoms manifest primarily at night is due to the body's need for energy while at rest. As glucose levels drop, the body reacts by displaying these symptoms in an attempt to signal the need for a glucose boost. Managing these symptoms entails regular monitoring of blood sugar levels and eating balanced meals. Moreover, it's crucial to converse with healthcare professionals regarding any medications, as certain drugs can affect blood sugar levels. In some cases, a nighttime snack containing complex carbohydrates and protein may be recommended to keep blood sugar levels stable throughout the night. Our fourth sign is restless leg syndrome, a neurological disorder that is often underrated but is quite prevalent. This condition is marked by an uncontrollable and overwhelming urge to move your legs. This urge often comes accompanied by strange and uncomfortable sensations deep within the legs. The sensations, which are quite difficult to describe, have been likened to aches, tickles, or even a creepy crawly feeling. Now, you may be wondering about the link between this syndrome and diabetes. The connection actually lies in the nerves. Persistent high blood sugar levels, a characteristic of diabetes, can cause damage to your body's nerves over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the onset of restless leg syndrome. The damaged nerves send mixed signals to the brain, leading to the sensation of needing to constantly move the legs. So if you've been experiencing discomfort or an irresistible urge to move your legs, it might be a good idea to get your blood sugar levels checked. Taking the fifth spot on our list is the sleep disorder known as sleep apnea. This is a sleep-related condition characterized by frequent pauses in breathing during sleep. These pauses, or apneas, can happen many times in a night, resulting in intermittent sleep and often leaving the individual feeling fatigued the next day. The connection between sleep apnea and diabetes is particularly noteworthy. Scientific research has found that individuals with diabetes, especially type 2 diabetes, are significantly more likely to suffer from sleep apnea. The reason behind this is multifaceted. One key factor is that both conditions are associated with obesity. When excess fat accumulates around the neck area, it can obstruct the airway, leading to sleep apnea. Furthermore, the metabolic disruptions caused by diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance can lead to imbalances in the body's energy use during sleep, causing interruptions in breathing. It's this complex interplay of factors that leads to a higher risk of sleep apnea in people with diabetes. Moving on, we come to the symptom of increased thirst, also known as polydipsia. If you're finding yourself frequently waking up in the night with a dry mouth, feeling unusually parched, it could very well be a telltale sign of diabetes. This happens due to high blood sugar levels, which cause your kidneys to work overtime to filter and absorb the excess sugar. When they can't keep up, the excess sugar is excreted into your urine, dragging along fluids from your tissues. This triggers more frequent urination, which may leave you dehydrated, hence the increased thirst. Managing this particular symptom involves keeping your blood sugar levels in check. Regular monitoring, a balanced diet, regular physical activity and medication, if prescribed by your doctor, should help. It's essential to consult your healthcare provider for the best ways to manage your symptoms. Don't ignore increased thirst, especially if it's accompanied by other symptoms of diabetes, as it's your body signaling that something might be off. The seventh sign to look out for is fatigue. If you find yourself constantly feeling tired, despite clocking in those essential hours of sleep, it may be an indication of diabetes. Fatigue in diabetes occurs due to the body's inability to use glucose as a source of energy efficiently. When your body cannot convert food into energy due to a lack of insulin or insulin resistance, you might feel persistently weary. This is because the cells are being deprived of glucose, which they require to function optimally. Managing fatigue in diabetes involves maintaining steady blood sugar levels, which can be done through regular physical activity, a balanced diet, and regular checkups with your healthcare provider. Ensuring that your body gets ample rest and that stress levels are kept to a minimum are also crucial in managing fatigue associated with diabetes. Dry mouth, medically known as xerostomia, is another notable symptom to be vigilant about. Characterized by an absence of saliva, individuals may find themselves frequently waking up with a parched mouth despite maintaining adequate hydration levels. This could potentially be a sign of diabetes. This symptom arises because high blood sugar levels can decrease saliva production, leading to dry mouth. Elevated blood sugar can also lead to increased urination, which can result in dehydration and subsequently a dry mouth. Managing this symptom entails maintaining good oral hygiene, staying well hydrated and using saliva substitutes or stimulants if necessary. Chewing sugar-free gum or sucking on sugar-free candies can also help stimulate saliva production. Consultation with a healthcare professional is always recommended to accurately diagnose and treat this condition. The final point to note is the occurrence of sleep disturbances. If you find yourself battling insomnia or facing other nighttime restlessness, these could likely be tied to diabetes. Chronic sleep disturbances are often seen in individuals with diabetes due to the body's inability to regulate blood sugar levels, causing nighttime hypoglycemia or hyperglycemia. Hypoglycemia or low blood sugar can trigger symptoms like sweating and shaking that can wake you up in the middle of the night. On the other hand, hyperglycemia or high blood sugar can cause frequent urination, leading to multiple bathroom trips at night. Managing these sleep disturbances typically involves better controlling blood sugar levels through medication, diet changes, and exercise. Therapies like cognitive behavioral therapy can also be beneficial in addressing insomnia. Thus, if you're having trouble sleeping, it's essential to consider the possibility of diabetes and consult a healthcare professional for accurate diagnosis and treatment. To summarize, the signs of diabetes that can appear at night include frequent urination, night sweats, symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep disturbances. Remember, these symptoms are not definitive proof of diabetes, but they may indicate a need for medical consultation. It's always best to consult with a healthcare professional if you're experiencing any of these symptoms. Diabetes is a condition that affects millions of people worldwide. Being aware of the signs, especially those that occur at night, can help in early detection and management. Don't forget to like and subscribe if you enjoyed the video.